Hi, everyone. Welcome to the Patient Story. It's Stephanie, and I am really excited to introduce our guest today, Dr. Kimmie Ng, who works at Dana-Farber in Boston. Dr. Ng, thank you so much for joining us today.
Thanks for having me.
I watched some of your videos and, the way you were talking about the work that you do, and I could tell you're very passionate about what you were focused on. But what really intrigued me and what I'd like to start off with is how you shifted into this work with patients. As I understand it, you were very interested on the molecular level and the research side, and then the actual experience in med school of being with patients shifted you. Is that right?
That's right. When I started in college, I actually majored in the molecular mechanisms of biochemistry and really thought that I was going to be in the lab, delving into the, intricate complexities of how cells divide and how cancer works and how it spreads. But as I progressed through my training, going to medical school, having increasing interactions with patients, it really struck me that I wanted my work to be more directly relevant to patient care. And I wanted the research that I was doing to be able to have more of an impact on the patients that I was meeting and treating than I could do from the laboratory bench. And so with that, I shifted more to a clinical and translational type of research where I would work on patient samples and analyze tumors and look at diet and lifestyle factors and see what of those in combination or singly could help to make people's survival better and help them to get through their treatment better.
Which is music to all of our ears. The work that you do. First, personally, want to thank you for that. Having gone through cancer myself, even though it wasn't GI or anything, but just the work means something different. I feel for those of us who've actually gone through the experience. Both. I know you work in both the research and clinical side, and that gives great perspective. And on that note, would love to learn more about what you do at Dana-Farber at the Colorectal Cancer Center. I know it's specifically young onset. What does that mean for folks? And we'd also love for you to highlight some of the work you'll be doing with that CCA study. I read microbiome anti-tumor immunity, and I was like, well, that sounds interesting. I'd love to hear more.
Sure. So when I started in medical oncology, I knew from a very early stage that I wanted to focus on gastrointestinal cancers and specifically colorectal cancer because there was still so much to do in terms of improving the outcomes and finding new treatments for patients with these diseases. And so very early on in my training, I decided to specialize in gastrointestinal cancer and colorectal cancer. Currently, I see patients 1 day a week, and the rest of my time is spent running the Young-Onset Colorectal Cancer Center, which really focuses on young people under the age of 50 who are diagnosed with colorectal cancer, as well as conducting research on the diet and lifestyle factors that may impact how long a patient lives with colorectal cancer, and what some of the risk factors are for why more and more young people are developing colon cancer at younger and younger ages, because that currently is still a mystery where we don't know in the vast majority of patients why it is that they became diagnosed with this disease.
So I would like to ask, on that note about, I know there's still a lot to learn when it comes to why this is happening, but can you dive a little bit into those numbers in terms of just generally, we've heard a lot of us in the community, in the patient community, more and more young people seem to be getting diagnosed. And the question is it because there's more screening, more testing? Like, what is this all about?
So it isn't purely a screening effect. So just to review the overall numbers, colon cancer is actually the third leading cause of cancer in both men and women in the United States. And when you combine men and women in the US, it is the second leading cause of cancer death. So really a very big problem that affects thousands and thousands of people every year. Fortunately, we do have very effective screening programs for people over the age of 50 currently, where they're able to catch cancers at an earlier stage and also before they become symptomatic, often at the polyp stage where you can completely prevent the cancer. And as a result of those successes of screening, the incidence of colorectal cancer in people over the age of 50, as well as death rates from colorectal cancer, have really been steadily declining over the years. Unfortunately, that same improvement has not been seen in people under the age of 50 who are not being routinely screened. And it's occurring at about 2% per year, the rise in people, in both men and women under the age of 50. It's happening for both colon and rectal cancer. And it's actually happening in most states in the US, as well as many countries around the world. They're predominantly higher socioeconomic status countries. And again, the reasons for these trends are still unclear, but it is a global phenomenon. The reasons for why this is happening are one of the mysteries of medicine, honestly. We do know that diet and lifestyle seem to have a strong link to colorectal cancer no matter what age you are. And so we do suspect that perhaps it's diet, lifestyle, perhaps it's environmental exposures other than diet and lifestyle, such as antibiotic use, that may be influencing whether young people are developing this at younger and younger ages. I will have to say we've done a couple of studies that did link obesity and sedentary behavior to a higher risk of developing colon cancer under the age of 50 in cohorts of women. But the vast majority of our patients that we see in clinic are not obese, and they are active and they eat healthy diets. They follow very active and healthy lifestyles. And so clearly it's really not just those factors that are leading to this. And so this led us to hypothesize that perhaps it's actually the microbiome. So the microbiome is the trillions of organisms that are living in all of our guts right now that have a profound impact on a variety of different chronic diseases. And colorectal cancer is one of the ones that are probably most influenced by the microbiome because the cancer is developing right there in the gut where all these trillions of organisms are living. And so we do know that diet and lifestyle very closely shapes the composition of our microbiome and which organisms are in there. And it is therefore likely that diet, lifestyle factors and environmental factors that may be affecting the microbiome in a way that may be leading to colorectal cancer and also affecting how well our immune systems are able to either fight off or not fight off the development of a cancer such as this.
Wow, that was a lot. I really appreciate you going through all that because I think it addresses so many of the questions we have. I've interviewed, the interviews we do are very in-depth, and the ones we've done for the young onset colorectal cancer cases, the patients, is what you pinpointed. They're active, they're cyclists, they, prided themselves on being very active and eating healthfully before they were diagnosed. So it's so interesting when you talk about the microbiome, and it's one of those words I think we're hearing more about in terms of us non-medicine, non-scientist folks. But I also understand that you are getting to really study this with that CCA study over the next couple of years or a few years. I know we don't have a crystal ball, but what are you hoping, from where we are today, that you'll be able to help determine or where you'll be, by the time the study concludes?
Yeah, so I was very fortunate to get a 3-year grant from the Colorectal Cancer Alliance to really study how exactly the microbiome may be influencing the risk of developing colon cancer in young people. And what we're trying to do is understand how the microbiome is different in young patients depending on how young they are. We know from clinical experience that it seems like the youngest patients under the age of 30, so in their 20s, even in their teens, may have a different type of colorectal cancer, one that might be a little bit more aggressive than the colorectal cancers that we typically see, even compared to patients who are developing colorectal cancer in their 30s or in their 40s, and certainly different than those who are developing colorectal cancer who are over the age of 50. So we really want to delve deep into how the microbiome is different by what decade of age you're diagnosed, and also compare to healthy young people who do not have a diagnosis of colorectal cancer, so we can start to get some hints about whether there's a special microbiome signature that may predict who is at higher risk of developing colorectal cancer. And if it's true that there is a specific signature or a high-risk microbiome that we can identify in healthy young people, we would be able to know who to target for earlier screening so that we can hopefully prevent the cancer from happening in these young people or catch the cancer at an earlier stage when it's a lot more curable. Because the microbiome has such an impact on our body's immune system as well, we'll also be studying the effects of the microbiome at these different ages of diagnosis on different components of the immune system. And one very cool part of the grant is that we'll be collecting stool samples from patients in their 20s versus their 30s versus over 50, as well as from healthy young people, and actually transplanting and transferring these stool samples with their microbiome into mouse models of colon cancer. And we will see what impact each patient's microbiome has on the development of colon cancers in these mouse models, and study how exactly it is that it's influencing the development of that cancer and how it might be altering that mouse's immune system to either lead to more aggressive growth or lead to less aggressive growth. And so our hope is that we better understand the mechanism of how the microbiome might be interacting with the immune system to lead to colorectal cancer. And through that, can we discover a signature or a novel target that we can then develop a new drug against that would really either decrease the chances of this happening in young people or better treat colorectal cancer that has already developed in a young person.
That's amazing. I was going to ask, how this study would be conducted. So what I'm hearing is people can volunteer their fecal matter, and then that will be transplanted or whatever into these mice with colorectal cancer and see the impact. Is that right?
Exactly. There are two parts to it. So the first is just collecting a lot of stool samples from a lot of different patients at young ages, a whole spectrum, across the whole spectrum of young age, also from a large number of people with older onset colorectal cancer above the age of 50, and then from a cohort of healthy young people without colorectal cancer. And we just want to analyze how the microbiome is different across these different ages and across cancer patients versus healthy young patients. And then the second part is to take a subset of these stool samples that we're collecting from these people and to transplant them into mice to really figure out what the mechanism is and what the effect is on the immune system.
Wow. Has this, to your knowledge, been done before with mice?
I don't think so in terms of looking at young onset colorectal cancer specifically. It's been done for other diseases and to look at other variables and how the microbiome might be related to those variables. But as far as I know, this is the first study of its kind for young onset colorectal cancer.
That's amazing. We're going to be so tuned into what happens with that. It sounds really exciting. And maybe we can also, I don't know if you need help in getting samples, we get the word out that this is obviously a great cause. And people
We
can.
do want to partner with as many young patients as possible. Even though the rate of colorectal cancer happening in young people is rising, it is still actually, in terms of the overall colorectal cancer patient population, a small number. And if we're going to be able to get answers as to what these risk factors are and what the underlying causes are, we're going to need thousands and thousands of young patients to participate in research studies such as this. So we all need to work together. We need to partner with each other to be able to get this work done quickly.
Absolutely. So we'll definitely talk more about that and see how we can help in getting that message out there. Actually, really quick question. You said the young onset subset of the population is still pretty small. What percentage roughly is it of CRC patients right now?
So approximately 150,000 patients are diagnosed newly each year with colorectal cancer, and about 18,000 of them are under the age of 50. So it is still a small proportion of all colorectal cancer patients right now who are diagnosed at a young age. But if the trends that we are seeing now continue, it is estimated that by the year 2030, 25% of all rectal cancer patients are going to be under the age of 50. So this is clearly going to be more and more of a problem in young people if the current trends continue and if we don't start to understand better what the risk factors and causes are.
Absolutely. And I really loved how you highlighted the studies that you're working on will not only possibly help with the actual treatment, but maybe preventative measures, which again is what we're all hoping for. Dr. Ng, I have to ask too, you talked about diet and lifestyle, and I know that that's just one area because as you've mentioned, it's multifaceted. There's a lot of different factors here. But when I was diagnosed, I can't tell you how many messages I got from everyone, and their grandparents and their moms and uncles, whatever, about, oh, well, you shouldn't eat this and don't eat this and don't eat that. Meanwhile, my oncologist was pretty lax. I think her point was just do what makes you happy to get through treatment. So when patients, and I hear this in so many interviews, are bombarded by these messages of what you should and shouldn't eat, I mean, where should they really go? Whom should they be listening to about this?
So your experience is exactly the experience of so many of our patients. I think part of the problem is that there isn't a lot of rigorous research out there to really determine what the ideal diet and lifestyle should be for a patient with cancer or to prevent cancer. And this is an area that I started working on right out of fellowship, and actually started during fellowship, to really try and study this in a more rigorous fashion. Now, it is true that most of the diet and lifestyle studies out there are still epidemiological, right? They're observational. And for the most part, they can only conclude that there's an association between a certain diet and lifestyle factor and the risk of developing a cancer or the likelihood of surviving that cancer. But it has been something that we've been focusing on to try to turn those observational studies into randomized clinical trials that will be able to establish causality, a cause and effect relationship, which is the gold standard for determining if something truly has an effect on cancer. And so I can give you an example. So I've been working on vitamin D for a really long time, and there has been a lot of evidence in the laboratory that higher levels of vitamin D seem to be associated with the development, less risk of developing colorectal cancer. And the vitamin D pathway is implicated in all kinds of mechanisms that are very relevant for cancer development. And so it made sense from the laboratory side that vitamin D may have a role. We then started to look at this in epidemiologic studies and very consistently saw that higher levels of vitamin D in the blood seem to be associated with a longer survival in patients with colorectal cancer, especially those with more advanced stages of colorectal cancer, actually in stage 3 and 4. And so when we saw this and all the consistent evidence supporting such a relationship, we did decide to translate this into the first randomized clinical trial of vitamin D supplementation for treatment of patients with metastatic colorectal cancer. This was called the Sunshine Trial, and it was published in JAMA a couple of years ago. And we did actually find that adding high-dose vitamin D to standard chemotherapy seemed to allow patients to delay progression of their cancer for longer than a lower dose of vitamin D added to chemotherapy. So that was the first randomized clinical trial of vitamin D in colorectal cancer. And the results were really encouraging and has now led to a National Cancer Institute sponsored phase 3 clinical trial called Solaris, which is currently ongoing and enrolling, hopefully by the time it's done, 400 patients with metastatic colorectal cancer to test whether high dose vitamin D has a role in the treatment of patients with this disease. And so it's so important to understand the role of diet and lifestyle. These are easier interventions, they're cost effective, and they're things that patients can do themselves that may perhaps impact how well they do. And so it's very important to study them, I think, very rigorously, and to have evidence-based recommendations to tell our patients, to give our patients recommendations.
Well, I'm glad that you were involved, in that first part, because obviously you had experience with patients firsthand. You knew what they were telling you, and it sounds like it helped drive you too in this research. And anything we can get in our toolbox to help us during any part of this is so welcome. Speaking of just, new developments and research areas, I wanted to switch a little bit and talk about targeted therapies, and get your thoughts on the space in general, where you think they are in terms of development, which ones seem most promising. And I don't know if you could talk about, VEGF, EGFR, RAF, anything that you think is relevant here.
Yeah, so targeted therapies have really revolutionized the treatment of patients with metastatic colorectal cancer in recent years. We used to not understand which mutations may predict for benefit or lack of benefit from certain drugs, but with the advent of cutting edge technologies that are available now to really sequence tumors and understand the genetic profile of tumors, we understand more and more which mutations have a role in predicting what treatments may help to benefit a patient. So the most striking example, I think, is the patients who have microsatellite instability high colorectal cancer. Now, among metastatic patients, it's really a tiny proportion of all metastatic patients. Way less than 5% of all metastatic colorectal cancer patients have this MSI high type of colorectal cancer. But if they do, it predicts to a remarkable response to immunotherapy drugs. And these are patients who, if they respond, may have durable remissions lasting years, which is amazing for somebody with metastatic disease. And so one of the biggest research priorities for us is to figure out, for the other 95% of metastatic colorectal cancer patients, how can we get immunotherapy to work for them? And here is where the microbiome may actually also have a role. We're just beginning to understand, as we were saying before, about how the microbiome interacts with our body's immune system, and that could certainly be a factor in why 95% of colorectal cancers don't respond to immunotherapy. Other targets include KRAS and NRAS. So KRAS is notoriously hard to target and develop drugs against, and approximately 50% of colorectal cancer patients do have a mutation in either the KRAS or NRAS gene. And where this knowledge has helped us in determining treatment recommendations for patients is that if there is a KRAS or NRAS mutation in a patient's tumor, then they are likely to not respond to drugs targeting the EGFR pathway. The other pathway that has been important for colorectal cancer is the VEGF pathway. So these drugs that target the VEGF pathway, we think work by targeting the mechanism by which tumors make blood vessels to feed themselves. And so clearly trying to interfere with that may help to kill the cancer and perhaps help the patients not have progression of their cancer and live longer. And so agents such as bevacizumab that are added to chemotherapy do seem to improve outcomes for patients with colorectal cancer. We have a bunch of other targets too that have come on the scene. HER2, for example, has been a known target in breast cancer for a really long time. And we're now understanding that about 5% of patients with colorectal cancer also have HER2 overexpression of the HER2 gene. And in those patients, it seems like drugs that target the HER2 pathway, similar to the ones that are being used in breast cancer, may also be effective in these patients with colorectal cancer and overexpression of the HER2 gene. A lot of those trials are still ongoing, but they're being increasingly incorporated into the armamentarium of drugs that we have to treat these molecular subsets of colorectal cancer. And then finally, the other gene that's very important to know the status of for a patient with colorectal cancer is the BRAF gene, which is present in approximately 10 to 15% of all colorectal cancer patients. We now have new drug combinations that target the BRAF pathway, whereas patients previous to these discoveries didn't have very many treatment options. And so There has been so many advances in the last few years in regards to these targeted therapies. It's very important that all colorectal cancer patients with metastatic disease make sure to get their tumor profiled so that these decisions can be made and more precision medicine approaches can be recommended.
Wow, thank you for you wrapped up something very complex beautifully. And yeah, I think that that was so easy to understand for anyone listening, even for the first time about this topic. I did want to ask, and you touched on it just now. You said people should make sure to get their, the genetic profiling done. I think at, the large institutions and research institutions like Dana-Farber, I went to UCSF. I mean, I think patients sort of expect that that happens. We know that a lot of the patients of cancer treatment in this country are going to community hospitals and things like that. So I guess from that perspective, is there anything you could say to those folks who maybe the people they work with, they're not so much research oriented? What should patients and caregivers be armed with in terms of what to ask for, how to approach treatment, especially if they're metastatic?
It's a great question. And while it is true that more and more centers, whether academic or community, are in fact doing this and sending patients' tumor samples off to be profiled and sequenced, we do know that there are still many, many patients out there whose tumors have not been profiled. So I do recommend that patients be informed, in terms of the status of their key genes. One is whether or not they have microsatellite instability. The KRAS and NRAS, the BRAF, and the HER2 are the ones right now that have treatment implications. It can really affect the types of treatment that you're recommended to have knowledge of whether or not these molecular alterations are present in your tumor. And so if it is not offered that the patient's tumor sample is going to be sent off for sequencing, patients should definitely ask their oncologist about it.
Okay, important first step. Just ask for that as your basic, understanding of where to move forward, how to move forward. I just have a couple more questions left, and one is similar to this, but more general, which is we often get asked by our audience, both patients and caregivers. There's so many things once we're faced with any cancer diagnosis. We don't know what to ask. We don't know the very basic first questions and issues that we should be thinking about. One, you just highlighted, I think, for particular cases, which is know more information about yourself and seek it if you can. Do you have any other sort of guidance for people on this?
So I think it's so important to be able to openly ask and talk to your oncologist about any question that may be on your mind. And, even to ask, are there any questions I should be asking that I haven't asked yet? But in general, the basic things to know are, what kind of cancer do I have? Where has it spread to, if it has spread? What stage is it? What other tests do I need to be able to determine what stage it is or to help determine what type of treatment should be done? Are there any other types of doctors I should see? Is there a role for radiation? Is there a role for surgery? Should I be meeting with those doctors? And then what are the treatment options? And, often there are a few to choose from. And so what are the data supporting each and, which one would be recommended and why? There are also clinical trials out there, and a clinical trial is not for everyone, but it's always good to know whether or not there is a clinical trial option out there that may improve your chances of having a good outcome. Or even if not, it just helps to advance the field of research and our understanding for future patients. And, other things are, what are the side effects of treatment? So if you have decided on a treatment, what are the likely side effects? It's important that patients get good teaching about what to expect. And if there are side effects, how to manage them. It's very important to know who to call in case there's a problem. There has to be a good communication plan with the treatment team. And then there is still so much more than just treating the cancer. There's everything else. There's, especially for our young onset colorectal cancer patients, there may be questions about impact on fertility. There are effects on sexual health. There are concerns about nutrition and diet and lifestyle, like we were talking about. And then psychosocial support, is so important to help a patient and their family get through this. It really takes a village to help comprehensively care for a patient with cancer, and all of those resources should be used so that you can get the best treatment possible.
Thank you so much for summing that up for us. I think, yeah, you're talking about fertility preservation. That comes up a lot, and doctors very often, are trained obviously to take care of the cancer, and it is, up to patients and caregivers to bring up certain issues as well. So it's a team effort. My last question is fairly open ended. I think, you've already talked about targeted therapies and the microbiome research and where you hope your specific study will land in a couple of years. Is there anything else you'd like to share with patients and caregivers about the advancements of medicine and research and what it means for them? Because as we know, when we're first diagnosed, we always look at prognosis, and even if we're told not to, but the numbers may not reflect, what's really happening right now. So yeah, just any last message you have for people about that.
Yeah, I will say that, I think the future is bright. There have been such discoveries in cancer research that were before unimaginable. The example I always give is the example of immunotherapy and how well it does work for the, under 5% of metastatic colorectal cancer patients where it currently works right now. Even in somebody with metastatic disease, there is now a chance perhaps of long-term remission and cure, whereas that wasn't always something that was thought to be achievable for somebody with stage 4 cancer. And so the hope in science is limitless, and it has resulted in discoveries that have changed the way patients are treated, and that has more than doubled the survival of patients with colorectal cancer. And so there are advances being made every day. The longer that you are around and thriving on treatment, the more new advances will be made. And so, definitely talk with your oncologist about whether there are research opportunities that you can participate in, whether they be clinical trials or studies of the microbiome where you can contribute your stool, or even studies of diet and lifestyle questionnaires. There is still so much to be learned that will benefit you, but will also benefit all the other future patients out there.
That's wonderful. Dr. Kimmie Ng with Dana-Farber, I really appreciate your time today, and the work that you're doing. We're going to keep up to date with exactly all the research that you're, diving into, and it all seems very exciting. So again, thank you for joining us today.
Thank you for having me, and thank you for sharing stories of patients and also perspectives from physicians. I think that's super useful for all the cancer patients out there.
Absolutely. We look forward to working with you again soon.